Peace and greetings, everyone. This is Jahid Farr, and I'm creating this particular video to discuss our wonderful and magnificent internal transportation system, and it's better known as the cardiovascular system, which consists of the heart and blood vessels, and in particular the veins, arteries, and its smaller, minute capillaries. Okay. I'm going to organize this video to speak about four basic topics relating to the cardiovascular system. The first being anatomy and physiology. The second being the importance of blood pressure. The third topic being signs and symptoms when borderlining heart disease or heart illnesses, and also cardiovascular issues. And fourth and final being um, actual diseases of the cardiovascular system. Okay, so let's jump right into it. The anatomy and physiology of the heart is this: it sits in the middle of the chest, right up behind the sternum, and in between two lungs. It's situated in the middle of the chest again, but it leans more towards the left side of the chest. So it sits in the middle, but more towards the left side of the chest. It is encased inside of some very tough fibrous tissue known as the pericardium. And the pericardium's main goal is to protect the heart in case of injury to the sternum. Okay, very important. Again, we also have veins and arteries, which exceed 100,000 miles of veins, arteries, and capillaries to transport nutrients throughout the body, but also transport waste and deoxygenated blood away from the body and to the excretory systems of the body. So that's very important, the functions of the cardiovascular system. The heart and its corresponding blood vessels are essentially muscles and muscle fibers. Okay, the heart is controlled by the mind, your unconscious mind, but also by your conscious mind. It could be controlled by your conscious mind, but I say it's controlled by your unconscious mind because it's working right now while you're watching Jahid's Farr video without you actually being aware of it. But it also, you can also train your mind to control the heart and cardiovascular system in general, to speed up your blood pressure rate or to lower your blood pressure rate. So that's important too. It's very magnificent if we spend time studying and training our internal transportation system. Again, very important thing. I have to state that the heart is made up of four chambers, and the top two chambers are known as the atriums, and the atrium's purpose is pretty much to receive blood either from the body or from the lungs. Okay, so oxygenated blood from the lungs, and then deoxygenated blood and waste from the body. The bottom portion of the heart, which are two ventricles, and these two particular chambers are used to actually pump the blood away from the heart, either to the lungs or to the excretory systems of the body, and or to the rest of the body to provide nutrients. Okay, so that's pretty much the anatomy of the heart. Okay, the four chambers. Okay, so moving right along to the second topic, which is blood pressure. So blood pressure is essentially the force of blood against the walls of the blood vessels. So the actual force, how things are pushed out of the heart or into the heart, and then that pressure against the wall of the vessels. Okay, so again, going back to the actual anatomy of the heart, you have the four chambers. So you have the top chambers, which receive the blood and then push the blood into the ventricles, and that's known as the systolic phase. Okay, because there's a contraction that happens within the heart that actually pushes or fills up the ventricles to get it ready to contract and push that blood either to the excretory systems, mainly the lungs, but also to the remainder of the body. Okay, so that contraction gives you that systolic number, which is the higher number, which is usually between like 120 or 130 or something like that. So that gives you the contraction of the heart. Okay, the diastolic number, which is the lower number, is pretty much when the heart relaxes to fill up with blood. So when the heart relaxes, right, it's not in the contraction phase now, it's in the relaxation phase to fill up with blood. And this relaxation phase allows for that diastolic number, which is usually between 80 and 90, something of that nature. And it's very important to point out that people who work out, okay, people who exercise and who have a stronger heart will usually have a lower blood pressure, usually. And I say usually because there are other factors that play into that, such as any kind of waste that may be built up, fatty tissues around the heart, but also fat deposits within the veins and arteries that may contribute to the contraction and relaxation of the heart. Okay, but usually a person who works out will have lower blood pressure because their heart is able to contract and pump more blood without being it's not as lazy. It's more energetic, so it is able to contract and pump more blood. For example, just like your biceps, if you're stronger, you can contract using less force than a person who's never lift weights. I mean, it's going to be harder for them to contract their muscle using the weight. But if you work out every day, then it's much easier to contract the weight. Okay, it's much easier to do that. And that's the same thing with the heart. The heart is a muscle, and the more you work it, the easier it is to contract and relax, and thus filling up the veins and arteries with blood. Okay, very important to note that again, and that gives you your systolic and diastolic numbers. Okay, so moving right along to the third topic, which are some signs and symptoms to be aware of when borderlining heart disease. It pretty much deals with the veins and arteries being blocked. Okay, so for example, if you're blurriness can be the result of many things, but most importantly, blurriness will happen because the capillaries, which are very minute veins and arteries within the eyes, may begin to break up and become waste builds up in them. And if waste builds up in them, you're not going to be able to interpret your vision there using the eyes. So blurry vision can be attributed to signs and symptoms that you're borderline heart disease. Okay, same thing with ringing in the ears. Same thing with tingling in the fingers and the toes. Same thing with loss of hair. Again, contributing back to the capillaries that run to the ears or to the fingers or to the hair follicles. If they begin to build up in waste and begin to fall off, then the functioning of the hair will begin to fall out. The functioning of the ear will begin to degenerate. The functionings of the fingers and touch and inside of your feet will begin to degenerate, and you'll feel those tingling feelings. So it's very important to pay attention to any kind of signs and symptoms that your body is trying to show to you. Okay, like again, those signs and symptoms are pretty much causes that your body is borderlining some of the major heart diseases. Okay, so the fourth and final topic to touch on is those major diseases that are seen that are most diagnosed by doctors and then naturopaths alike. Most importantly, MDs. They do the diagnosis. NDs, natural doctors, just do health assessments. Okay, wanted to point that out. And again, so some of the major cardiovascular diseases are thrombosis, and thrombosis is strictly blood clotting. Blood clotting due to waste within the veins and arteries. Okay, you have thrombosis. You have arteriosclerosis, which is pretty much the hardening of the arteries. Again, waste in the veins and arteries. Then you have a subset of arteriosclerosis, which is atherosclerosis, which is now after the arteries have been hardening for a while, now they start to increase. And then that increasing in the heart is pretty much a constant buildup of plaque and waste within the veins and arteries, particularly the arteries. And that becomes atherosclerosis, okay? You also have like myocardial infarction, which is simply a fancy way for saying a heart attack or something like that. And I have to discuss that, heart attacks and strokes, because they relate, again, going back to thrombosis, okay? A subset of thrombosis is embolism, okay? And what that means is you have a blood clot, but now the blood clot has broken off and now it's circulating throughout your arteries. And when this circulates, that's very, very, very dangerous, because if it blocks the flow of blood to the heart, that's a heart attack. If it blocks the flow of blood to the brain, that's a stroke. Okay, very, very important that you take steps to naturally keep the blood from over clotting. Clotting is a good thing. It's a mechanism from the body, from the body, for us, if we get cut, not to bleed to death. So clotting is a good thing, but unnatural clotting and then embolism, which is the breaking off of those clots within the circulatory system, is a hazardous thing. So be careful of that. What else? What is another? They're pretty much the basic ones. Again, relating to, and all of these again relate to waste in the veins and arteries. Waste in the veins and arteries, again leading to the buildup of this plaque or waste within the veins and arteries. And then if it happens in different places, again, such as the brain or such as the heart or such as in the veins, such as varicose veins, then it's given different names, such as varicose veins or coronary arterial plaque buildup, or is given the name of stroke, or is given the name of myocardial infarction. It's given different names, but forget the names. The names are irrelevant. What's happening? What's happening is the buildup of waste within the body, and when it builds up in different parts of the body, the specialists sometimes give it different names, but the cause of it is pretty much the same. What are you putting into the body, and then most importantly, how active are you using your body, using your limbs? I think that's very important to point out, because a good way of healing yourself from a lot of these and preventing a lot of these diseases is to feed your body natural foods. You know, I can't stress that enough. Natural raw foods, plants, vegetables, fruits, drinking lots of water. That will help thin your blood out and keep your blood from over clotting. All of these basic steps that we can take to prevent a lot of those degenerative diseases of the cardiovascular system is real. It's not a joke. This is this is real life. I want to stress that. Yeah, so I think that covers the major topics that I wanted to go over. Again, all questions, comments, concerns are welcome. Thank you for your time. Have a great day. Bye.